Stop by any Food City store to donate to the Share Your Christmas food drive.
The Chattanooga Heart Institute at CHI Memorial is such a wonderful resource for us here in the Chattanooga area. No doubt you'll think about the talented cardiologists that they have on staff, but are you aware of all that they do with vascular surgery? We are so happy this morning to have Dr. Mark Fugate. He is a vascular surgeon at the Heart Institute. So nice to talk with you.
Thank you. I'm happy to be here.
One of the things that you'll have to kind of elaborate on this for me a little bit, but one of the things, as I understand it, that you're so proud of at the Heart Institute is this comprehensive care that you are able to provide. So you are a vascular surgeon and you're working hand in hand with the cardiologists who are there. How do the two practices overlap?
Well, that's an excellent point. And I think the thing that makes this so special, this collaboration that we have now, is that cardiac disease, cardiovascular disease, and peripheral vascular disease all overlap so much. In other words, many of our patients are the same because all the risk factors are the same. So what we have now with our expert cardiologists that you mentioned, top-notch cardiac surgeons and now vascular surgeons, all under one roof, we truly have the entire cardiovascular system covered.
Okay, so you mentioned the peripheral artery disease. Y'all call it PAD, P-A-D. It's quite prevalent, as I understand it, in our neck of the woods. Why?
Well, so unfortunately, and I say this with love because I'm from the South, but in the South we tend to eat poorly and maybe not take as good a care of ourselves as we should. So diet and exercise are certainly a factor, but another thing that's really common in our area still is smoking. So we have the perfect setup for peripheral arterial disease as well as cardiovascular disease, as I mentioned, because they really go hand in hand.
Okay, so with PAD, with peripheral arterial disease, that's going to affect primarily your legs. Is that right? That peripheral nerve that goes down your leg?
So it is more common in the legs. Truly, the mechanism of peripheral arterial disease, atherosclerosis or plaque formation in the arteries, can really affect any of the arteries in your body. But it is much more common in the legs. It affects about 8 to 12 million people in the U.S. alone.
Is this the kind of thing, you can get into the symptoms that people might be experiencing as they're watching you talk, but if you ignore this, is it the kind of thing that can lead to a blood clot? In
a sense, yes, but when we think about the spectrum of symptoms, so there are a lot of people who have peripheral arterial disease who have no symptoms, but it's definitely along a spectrum of symptoms from asymptomatic all the way to potentially limb-threatening ischemia or lack of blood flow. So I think that's one of the tricky things about it is many people either have mild or no symptoms that can progress over time before they seek medical attention for it.
So what are some of those symptoms? Do you tend to get tired when you walk, or what will you experience?
The first symptom most people notice is with walking. Yes, that's correct. So a cramping feeling generally in the calf of the leg, can also be in the thigh or the buttock, that occurs with walking. Tends to be severe enough that people will have to stop walking, and usually the symptoms resolve with rest. So that's the first thing that tends to drive people to medical care.
In terms of testing it, if someone's listening to you today and they're thinking, you know what, I was talking to my neighbor last week and he was mentioning this very thing. Is it an invasive test, or how do you discover it?
That's one of the things I love most about what I do, because this condition especially lends itself to really just a good visit with your physician. So it's a conversation you can have with your primary care physician. Many of these things can be sorted out with a conversation and a good physical exam. And then if the next step does lead to testing, it's non-invasive testing, typically ultrasound based. So you can get an awful lot of information just with a conversation with your doctor.
You know, I think one thing that COVID has certainly driven home to me and to so many people I know is you hear about people who are diagnosed with it and then they discover they have an underlying health condition, right? We're realizing that maybe we're not as healthy as we otherwise thought we had been. So if someone comes to your practice and maybe you diagnose them with PAD, as a matter of rote course, will they then also check in with one of your cardiologists, or is that a case-by-case basis?
Case by case, but you bring up an awesome point about peripheral arterial disease. In and of itself, it can cause significant morbidity and mortality with the patient, but one of the key things that you just hit on is it's an independent risk factor for cardiac disease. So you may have this as your only symptom, but it may uncover other things. So again, that's why we get out and talk about it. That's why we do things like this, is to let people know that, hey, this can be a problem with your legs, but it can also be a big problem with your heart. So that's why diagnosing it early is so important, so you can begin to modify risk factors before worse problems happen.
We're down to about a minute and a half left. You did mention that smoking is one of the risk factors, so I'm sure you do encourage people to stop. Is it a all or nothing kind of stopping? Do you encourage them to kind of ease their way into it, whatever makes them successful?
Stopping smoking is very challenging. I don't know that personally, but I've talked to so many patients who have struggled with it, and most people have to quit multiple times. So anything you can do to trend towards stopping, should be applauded. So if you can cut your smoking in half, first step, that's great. But the ultimate goal needs to be to stop completely.
All right, Dr. Mark Fugate, thank you so much for sharing some time with us this morning.
Yes, ma'am. Thank you.
You will find him along with the rest of the team at the Chattanooga Heart Institute at CHI Memorial. They have locations across the viewing area from Hickson and Ooltewah all the way into Jasper, Ringgold, also in Cleveland. The phone number is 697-3700. You can go online to ChattanoogaHeart.com, also memorial.org/vascular. We're back after this.
Don't let back or neck pain get in your way. Surgery or pain medications aren't the only options. Chattanooga Integrated Medicine Centers